Hi, I'm Dr. Martin Rutherford. I am a certified practitioner, functional medicine practitioner, chiropractor since 1979. And this is
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
Okay, and we're kind of partners in crime here in a practice which has evolved into a chronic pain practice. We put together functional medicine. You know, we say we put together functional medicine, functional neurology, but frankly, we put together functional medicine, functional neurology, and chiropractic to address. I don't know. I mean, we don't mostly say that, but yesterday that was very valuable in explaining the understanding of why chiropractors were positioned to really develop functional medicine and functional neurology. There are 600 structures in the body known as bones and muscles and joints that can affect chronic pain, and it's nice if you have a background in those, along with assessing the brain aspect of functional pain, and also the rest of the stuff, diabetes and thyroid, which is the functional medicine part. Anyway, in doing so, we have developed a chronic pain practice, kind of developed on its own. And we started out with fibromyalgia, that kind of led to peripheral neuropathy, that kind of led to chronic fatigue. All three of those kind of led to restless leg syndrome, and on, because each one is related to the other. And one of the big challenges that we had as a profession, trying to understand how to diagnose these conditions, was that pretty much in the beginning, virtually everybody was coming in waiving their blood test status and waiving their diagnostic test status and their allergy test status and their heavy metal test status, and name it, all these tests. And the thing was, they wanted us to read these tests and say, here's what I got, what do I do? Well, the reality was the doctors who had done those tests had already done what needed to be done for those, and those people weren't better. So we had to start looking at things in a different way. Having been trained back in the mid-70s, we were trained before a lot of this testing was available. There was no MRIs, there was no CAT scans. Frankly, blood testing was kind of known to be something that was a little shaky because it was in evolution. I'm not saying that blood testing is shaky, but maybe we'll shed some light on that. I'm not saying it's shaky completely, but thyroid testing can be very unreliable if you don't understand the full parameters of the thyroid, and there are several cases like that. So we had to start looking at things from a more of a clinical perspective, going back to old school, taking significant histories, then doing a very thorough standard test. We do an exam, which Dr. Gates does, a complete neurological exam. I always say the most complete neurological exam you'll ever have, just because I know nobody else is doing that exam. So he does a very, very complete exam, and he knows what he's doing, and we get a tremendous amount of data from that. And then we have a long history, a 17-page history that's been put together for chronic pain issues, and I'll usually review that with the patient and then do a general systems exam based on that. And that started to bring things into light. But our topic today is one of a number of topics I think we're going to be doing over the next couple of months, maybe not consecutively, about testing. Because as we started to understand what was going on from those tools, we started to understand that indeed there was testing out there that was valuable. And in today's particular testing that ultimately evolved because of what our groups were doing,
right,
and demanded more understanding of, in this particular case, autoimmune problems and the gut itself, and how does somebody come in with a gut where they got constipation, diarrhea, bloating, alternating constipation and diarrhea. They don't go to the bathroom for 7 days. All their blood tests are normal. Their colonoscopies are normal. Their upper endoscopies everything's normal, but that person sat in front of us going, but I still have all this stuff. So, so that's what we're going to talk about today relative to the gut. We're going to talk about testing, diagnostic testing that we have found valuable to help to along with the history and along with the exam, but that we have found valuable not only to diagnose, but more importantly to treat.
Mm-hmm.
Was that kind of a
Exactly.
okay? Is that where we're at?
Mm-hmm.
So how do we come to? We're doing the gut first. Anybody who's watched us know we're like the gut maniacs. Okay, and it's small intestines, large intestines, liver, but it's everything in there, adrenal glands. But interestingly enough, I was thinking about this the other day. We're doing small intestines, we're doing large intestines, we're doing adrenal glands, which the alternative groups are all over.
Right.
The large intestines, the colonic people are all over.
Right.
But the things that the allopathic profession are all over is usually pathological, which means the liver and the pancreas and the kidneys. Usually, after the things we're talking about have gone south for a long time, and then damaged those. So if we embrace the gut, the way I look at it is we've taken the step back actually to what's creating the problem and all of those things.
Right.
And I think it's an important point because that's one of the things I get asked a lot. How come you do this testing and the doctors don't do that testing and so on and so forth? So, so that's kind of how we set this one up. That's how we came to this, to the conclusion of doing this topic and several of the next topics we're going to be doing. So when Dr. Gates came here, we were still kind of puttering around as to where to start with these cases.
Oh yeah.
We were still thinking, well, maybe we start with a lot of patients come in here have a iron or B12 deficiency. So we thought, well, we have to take care of that first because you need energy in the cells to be able to respond to anything else. We talked about doing autoimmune problems first. Let's go after the immune system with lots of herbs and botanicals. And that was a disaster. And what was. Yeah. And so how did we come to the gut?
I think because we finally had the epiphany that most of our patients got better once we focused on the gut. At that time, we were doing something called the 4R protocol. You can look it up. It involves basically, repairing the gut, reinoculating, reintroducing foods, all these different things, or reintroducing microorganisms. But we just observed most of our patients were improving during that phase of our treatment plan, and they needed far less supplements. And we started scratching our head and saying, well, maybe this is direction we need to go.
They didn't need the microorganisms, better known as probiotics.
Right. Yeah, we later realized that.
This is still out there. This is still a big deal. Take probiotics. Everybody comes in here with gut says, I am taking probiotics. And I say, has it helped? Occasionally a person will say it helped.
Yeah, a little bit.
Yeah. So we started realizing that wasn't it. And at that time, what Dr. Gates is referring to is we were doing all these other things first, and then we would do the gut, maybe 3/4 of the way through our program. And then that's when people would get better. One day we had this epiphany and we said, when do all the patients get, I said, when do you think all the patients really start getting better? Said, when we do the gut, you dummy. You would never say that.
I did say it that way.
But that's when we started to really focus in on it. And since I'm seeing that it's focused in on a lot in the general literature now. And then people are starting to get, now it's the 70% of the immune system is in the gut, so on and so forth. But the testing for the gut was and still in the standard model is still poor. I still get people that come in here every week. My colonoscopy is perfectly normal. They have every single symptom that there is. So how do you figure out what's going on in the gut? It might first be good to lay maybe some groundwork, for example, so that you understand where we're going with this. So why don't we talk a little bit about conditions that affect the gut?
Okay.
And maybe share that.
Right. In essence, what we're finding with a lot of autoimmune diseases, you've heard us mention 1 out of 6 Americans have an autoimmune disease today by some statistics. 1 out of 4 females have autoimmune thyroid disease. The immune system is never supposed to attack us. It's supposed to attack foreign invaders like bacteria and viruses. However, autoimmune disease is just escalating, in some cases exponentially, and we have to beg the question, why? All of us like to focus on genetics. Well, I have the genetics for rheumatoid arthritis, or I have the genetics for type 1 diabetes, or the genetics for celiac disease. But the question becomes, well, yeah, we all had the same genetics 100 years ago, but these diseases were not nearly as prevalent. Autism is the classic example. And so that's where these studies have started coming out, looking at things like molecular mimicry, which is where the immune system can start to attack a bacteria. And in that process, and that bacteria may be in your gut, the immune cells to that bacteria may look like a tissue in your body.
Which blows my mind.
Very interesting.
Would you really start to
Yeah.
expand on that for all of you who are those expansive thinkers? I mean, you start thinking about
it's good to
what
pause
he
on
just said,
that note.
because it's a big key. It's a big part of what we do.
It's a huge part.
It's a huge part of what we do. And you have tissues in you have organisms in your body that are bacteria that have similar structures to, or that are like gluten,
Right.
a non-bacteria that has a similar molecular structure to your thyroid
And your cerebellum.
and your cerebellum
And your peripheral nerves.
and your peripheral nerves. How mind-blowing is that? I mean, I don't know.
Yeah, exactly.
It is to us.
Mhm.
It is that a food has almost the exact same molecular structure as a nerve, as two huge parts of the nervous system and your thyroid. And so the immune system attacks that food and eventually
Can attack you because the immune system gets overactivated against that food or that bacteria. Rheumatoid arthritis, we talked about it at length last week relative to bacteria in the mouth called Porphyromonas gingivalis, bacteria in the mouth and the gut called Prevotellus species, and then bacteria in the urinary tract called Proteus mirabilis that all look like the joints in your hands and your knees and your feet. And it has been delineated that the immune process to those bacteria is involved with the autoimmune process for rheumatoid arthritis. Really, really interesting. And then things like MS, they're talking about leaky gut syndrome being involved in the overactivation of the immune system with MS patients and the eventual loss of regulation of the immune system in the brain, such that the brain starts attacking, such that the immune system starts attacking the brain. Inflammatory bowel disease, things like Crohn's disease. You may know someone with Crohn's. You may know someone with ulcerative colitis. These have been tied to leaky gut syndrome, such that certain bacterial populations may be permeating through the intestines, causing the immune system to get overactivated against them. And then as a result, the immune system starts killing the gastrointestinal tissue as well. Klebsiella is the bacteria with Crohn's that's commonly talked about. Or there's a yeast called Saccharomyces cerevisiae that is associated with that. And commonly that is in probiotics.
Yeah.
For all you probiotic lovers.
Yeah.
Skin disorders, we commonly see eczema as a GI issue. They talk about dermatitis herpetiformis with celiac disease. And then there's the whole world of obesity and obesity-related disorders that are affecting 2/3 of the American population. We have an epidemic in this country, body mass, and a lot of people like to chalk it up to excess caloric consumption,
Right.
Because we live in the industrialized world.
I hear it almost every morning on the radio.
Or lack of physical activity.
Yeah.
And though those are pieces of it, really the culprit of the problem is this issue of bacteria in the intestines that start to change once you start to eat the American diet that's high in saturated fat and processed carbohydrates. And there are some other maybe chemicals involved with that. And that shifts the bacterial makeup in the intestines towards obesogenic microbes, where pieces of these bacteria can start to float into the bloodstream, throw off insulin levels, which can dramatically increase body weight and eventually lead to things like diabetes. Also, type 1 diabetes is also tied with leaky gut syndrome. They're finding that leaky gut syndrome is prevalent and apparent before, like, a young child will develop type 1 diabetes. They can actually predict that now, which is really, really interesting. And then casein, so a dairy protein, has been associated with type 1 diabetes, where once the leaky gut syndrome is there, that dairy protein can leak through, the immune system attacks it, that dairy protein looks like the pancreas, guess what? Now you have
molecular mimicry.
Molecular mimicry. And then another case, there is something called Gad Antibody Illnesses, where these are antibodies that typically form more in adulthood, and they're immune cells that attack the pancreas and the cerebellum. We had a case of this this year where the individual was above the age of 60 and she developed basically rapid onset insulin dependent diabetes. And she went through our protocol and she was able to get off of her daytime insulin, basically a 2/3 reduction in her total insulin. and her dizziness and nausea went away.
Mhm.
And we just ran the repeat leaky gut test that we're going to talk about today, and her leaky gut syndrome has been corrected completely.
Yeah. And on that point, there are a lot of different conditions and entities there that Dr. Gates referred to, and some of them can be ascertained in different types of readings of certain blood tests that are maybe not standard ways of looking at blood tests. We're going to talk more about testing for the gut in general in the future. So today we're ultimately going to hit the leaky gut because it's pretty consistent in our practice that people have it. And there are people who don't have it. I saw you were looking at that when I stepped there yesterday, and you said, did you want to ask you a question? I said, I was just listening. And I noticed you flipping through, and she didn't have the leaky gut. I mean, not everybody has it. Okay, not everybody has it, but when you have it, it's important to ascertain that it's there and treat it. And the standard testing procedures out there aren't very good for that. So we're going to kind of tell you how to figure that out. So gut immune connection, you feel like you covered that, or you want to go over that a little bit more specifically? Everybody out there, I think, now knows, or if you're not watching probiotic commercials on television, you may not know that 70% of your immune system is in your gut. Is that where you wanted to go with that? Or?
Yeah, I think that's important. Let me see if I can bring this out. I'll just paraphrase.
We always have an outline, so we want to make sure that we don't miss anything here.
And yeah, 70% of the immune system is in the gut, as you alluded to, as we've talked about ad nauseum. There's this great article I attached today from the World Journal of Gastroenterology, where they're talking about autism in the gut, which is pretty interesting for a gastroenterology journal of that merit, so to speak. That's a big journal. And they were discussing autism, and they actually, frankly, criticized I think it was the American Association of Pediatrics, because this pediatric association in America said, well, there's information about leaky gut syndrome and a connection between that and autism, but we really need more studies before we do anything about this. And Dr. Rutherford and I will often laugh because research is fantastic and it helps us to present this information to you. Frankly, it's the framework from which we work in a lot of these cases.
Studies are overwhelming.
But the other side of it is you need to understand, as an individual who's listening to the media, they're going to say the research supports this or the research doesn't support it based on what are termed randomized clinical controlled trials that may take 10 years to complete, where everything is double blinded. So the doctor doesn't even know if he's giving you a placebo or the actual medication, so he can't influence you. And these studies are laborious, they take forever, and they're not always applicable, or there's not a lot of clinical utility lots of times when you have multiple issues involved. You can only treat one thing with these trials.
I was going to say, we could talk hours on that.
Whereas with these types of issues, there are foods involved, there are bacteria involved, there's rehabilitative supplements involved or medications involved. And how do you control for all of that in one big study?
These issues being the chronic pain conditions that come in.
And so in this journal, they said, you know what, because autism has gone up so drastically in the last 10 years, and we know that there is a ton of data linking the immune system to autism, and because so much of the immune system is in the gut, and we do know autistic patients do have problems with foods, and they have problems with food colorings, and they have all these other issues, we probably should investigate this further, because we can't wait any longer on this health topic that is now causing 1 out of 88 children, at least in this country, to have, by most cases, a disabling lifelong illness.
They didn't happen to mention excessive use of antibiotics in childhood.
They didn't in that journal that I read. But
that prestigious journal.
Yeah.
That's okay. That's okay. But that does appear to be one of the problems that is disturbing our general immune and gut problem, our immune system in our gut. Along with all the things that Dr. Gates said, and more. Stress.
Exactly.
Stress is the big unknown factor, it seems like, in treating these things. But so there's a lot going on in the gut, and from a perspective of the tissues, did you want to go further than the molecular mimicry? Did you want to go into the inside of the gut?
Yes, I do.
And how thin or thick it is, and so on and so forth.
Right.
and why it's so easily damaged, and why it can be recovered and all that type of stuff.
Absolutely. So I think it's important that for all of our viewers, if you're a visual learner, you probably just need to Google histology of the gut or histology of the gastrointestinal tract. Histology means what things look like on a cellular level. So Dr. Rutherford alluded to, and this is a common question, we'll talk about the leaky gut, and people say, but my colonoscopy was normal. So that's, that's
my biopsy was normal. I don't have celiac.
That's a completely different viewpoint. That's a macroscopic rather than a microscopic view of what's happening in the intestines. And so we're talking about a microscopic analysis of what is going on with your intestinal cells. So the gastrointestinal tract is a tube, basically, from the mouth to the anus. It's a tube. Frankly, it's outside of our bodies. And once we get past the stomach, and we're talking about the small intestines, which is a big feature of what we're discussing here with leaky gut syndrome, the cellular makeup of the intestines is actually relatively simple for this type of explanation. We have what's termed a mucosa. So think mucus. So the mucosa are it's basically one cell layer thick of skin that produces secretions like mucus.
Hang on, stop and think about that. It's one cell layer thick.
Yeah.
That's important to remember. It's pretty mind-blowing too.
Yeah, it is. That makes up our intestines.
Yeah,
absolutely.
So if you want to know why your intestines are so easy to damage, that's part of it.
And so we have this layer of cells, and they make mucus, they make other gastric secretions, they can make some hormones. They do all these cool things where they absorb nutrients, and that they have little things called villi. We've talked about those before that help absorption. It basically increases surface area so that you can absorb a lot of nutrients in a small length of a tube. And underneath the mucosa, we have what's termed the submucosa. And the submucosa is where the blood vessels come in, and then the nerves. So you have to think that in your GI tract, basically there's these tentacles of blood vessels there, so that when you eat, your pasta, that you can get the carbohydrates from the pasta into your bloodstream. That's the whole purpose of having a GI tract, is to absorb nutrients and to protect you from what you ate. And so the submucosa is there for that purpose. And then we have the muscularis, which is basically the smooth muscle of the intestines that helps to contract and move food through. It's called peristalsis. And for all you constipation sufferers, it's probably not working too well. So that is basically the generalized anatomy of the gut. The interesting thing we need to focus on is that the cells of your intestines, if this is a cell and this is a cell, they're tightly bound together by these proteins that are like cables. I always use the analogy of when you drive over the Bay Bridge going from Oakland to San Francisco. There are those massive cables stringing all of the towers together. And basically that's what you have in between your intestinal cells. They're called tight junctions for exactly that purpose, because they need to keep your cells tightly together. If we have tight junction problems, so if these proteins, and they're termed zonulin and occludin, and I hate to be so technical, but for the purpose of this lecture, you do need to know those terms. So let's just go through it again. Your skin in your GI tract, the cells of that skin is bound together by proteins called zonulin and occludin. With me on that?
I'm with you.
I
don't know if they're with you.
He's smirking at me here. Let's say it one more time.
Very quiet for
the intestine. Yeah, I know. It always makes me nervous. So the intestinal cells are bound together by two proteins called zonulin and occludin. And then those proteins need to be there for us to have good integrity of the intestines. If we lose that integrity, we can develop what's termed leaky gut, which is the whole purpose of this broadcast. So that is the leaky gut process. Also, too, we need to talk about a few other things. Bacteria. We talked about bacteria a little bit here today. We talked about bacteria a lot in other broadcasts. We all have bacteria in our gut. It's called the microflora. What we're finding with a lot of these autoimmune diseases, as well as with obesity and prediabetes, is that there can be an imbalance in the bacteria in the gut. And certain species of bacteria are more associated with things like diabetes. We talked about species of bacteria associated with certain autoimmune diseases. Relative to obesity and prediabetes and type 2 diabetes, we're finding that pieces of bacteria can break off and go into the bloodstream. That is called endotoxemia. I'm not saying that whole bacteria in your bloodstream, but we're saying pieces of bacteria are breaking off going into the bloodstream. And so the couple of terms you need to remember in today's vocabulary lesson are zonulin and occludin, as well as endotoxemia. Okay, and we can go on to the next point.
I think that was the next point. The leaky gut process. You mean?
Yeah.
So you basically, some of the things that might, when you say that the gut is on the outside of the body, I think sometimes that might be a little confusing. I mean, basically what Dr. Gates is saying is you have this gut, goes from your mouth to your butt, you know, and what it does is it protects everything else in your body from all the parasites and the bacteria and stuff that don't belong there. In addition to its primary thing, its primary function of food going through, and it should be having nutrients absorbed in all of the structures that Dr. Gates said those structures are. And I know some of you can't see what I'm doing here because some of this is on podcast. Is on a podcast, but basically you're getting absorption in these little fingers that come out, and those fingers are stuck together by all the stuff that Dr. Gates talked about. So if this food goes in here, this is how I talk. This is how I talk in the consult. So if this, and it seems to work, if the food is going in your gut and it breaks down, you're supposed to absorb the good stuff, and the bad stuff is supposed to go into the toilet. When the zonulin zones that Dr. Gates talks about that hold all of this together start to break down, stuff that should be in the toilet starts going into your system, including bad bacteria. Pieces of bad bacteria that are in your gut. And you always have bad bacteria in your gut. You basically said that. He said not all bad bacteria, but when that bad bacteria goes through here into your body. So what Dr. Gates means is like, this is outside of your body. This is like your skin. Your skin is protecting you from stuff, the inside of your gut. And a lot of people can't, like inside, outside. The inside of your gut is protecting you from things that should be outside of your body, the same way your skin is protecting you from things that should be outside of your body.
The best way to think of it is that, think of a donut. The center of the donut technically is not in the donut, right, that you eat. It's outside of the donut. Right. That's the analogy. So when those things get from your gut, which technically the inside of your gut is similar to outside of your body, and when it gets into you, bad things start to happen. Your immune system doesn't like it, and when bacteria start getting in there, your immune system not only doesn't like those, but as you're going to explain, those bacteria do bad things, as you've already explained in certain issues there. And to lay this groundwork, Dr. Gates is being very careful to be very specific to lay this groundwork for you to understand how the testing has to be. Exactly. That's why he was very careful to go over the scientific aspects of the zonulin and the occludin, because these are critical to diagnosing the leaky gut. So leaky gut process. You know, another thing I want to mention on the leaky gut process is a lot of people say, well, why are we developing leaky gut? I should have put that in as a big term. That's right. And we attached some articles on your favorite gluten being associated with leaky gut. What they're finding is that gluten is a toxin for zonulin. So those proteins, again, that bind the skin together are poisoned by gluten. And they've actually shown that in individuals with celiac disease, where it's active, or non-celiac gluten sensitivity, that when they eat gluten, it's actually the non-celiac gluten sensitivity patients that have more of an issue where the gluten poisons the zonulin, and you can see markers of leaky gut syndrome go up. Even more than the ones that usually get more of the brain and the nervous system stuff. Right, so let me take a step back. So we've talked about celiac disease. That's where the immune system kills gluten in the GI tract. Affects 1 out of 100 people. If you're a child, you'll get diarrhea and constipation and cramping and bloating. If you're an adult, more commonly, you'll feel things like depression or constipation, maybe some GI issues. neurological problems like balance issues or peripheral neuropathy. That's celiac disease. We've talked about a lot. Most of our viewers are familiar with it. There's also something called non-celiac gluten sensitivity,
which we've
talked about too, which can affect upwards of 10% of the population.
It's big.
First, it was tied to IBS. Now it's more being tied to depression.
Nervous system.
Exactly.
Brains.
So what they're finding is that when basically non-celiac gluten sensitivity came about because so many people started going gluten-free and feeling better, feeling really, really good. And so they had to come up with this entity where they said, okay, so you're eating gluten, you go off of gluten for 3 weeks, then you introduce gluten back in. And if you feel worse after you introduce gluten back in, you probably have non-celiac gluten sensitivity, because we don't have the lab testing yet to really verify this non-celiac gluten sensitivity versus not having it.
So we have to diagnose it old school.
Yes, based on your symptoms.
Based on your symptoms.
Exactly. And so they're finding that gluten causes more damage to the gut in terms of this leaky gut problem, not overall, but for this leaky gut problem in a non-celiac gluten sensitivity patient than it does for a celiac disease patient.
That's interesting.
Which is really, really cool. And they're also showing that food colorings can be associated with leaky gut syndrome. So food colorants are these chemicals that are in our pills, they're in our Skittles and our M&Ms, and they can actually damage these proteins that bind the intestinal cells together. Dr. Rutherford brought up stress. So I haven't seen
it's reading my mind.
Stress associated with leaky gut syndrome in the literature as much, but from a generalized physiologic perspective, what we know is that when we're under stress, we don't replace tissue when cortisol is up. And
your gut is 1 cell thick.
And it's supposed to replace itself about every 5 days, because skin replaces itself every 5 days, and cortisol shuts that off. And so one of the thought processes that we utilize is that when somebody's under stress for a long period of time, that can be a predisposing factor for leaky gut syndrome. They've done studies on, go ahead.
No, because I wanted to bring that up because I really feel it's important that we do that. Now, I know that it's easy to get attacked on because, as Dr. Gates said, there's not a lot of studies on it. But the reality is we have to deal with what we see every day. And when we didn't have MRIs and CAT scans and things of that nature, when people came into us with certain things, if somebody comes in here and they have 20 out of 20 symptoms of Hashimoto's thyroiditis, and the testing we know is unreliable or inconsistent or not even done or whatever, we know we're going to be treating that person for that. And so we see a lot of things. I mean, man, we were talking about Hashimoto's like before anybody even knew what Hashimoto's was. And that was thanks to my mentor, Dr. Karazian, who wrote a book called Why Do You Still Have Thyroid Symptoms When Your Lab Tests Are Normal? If that's you, it's because you have Hashimoto's. And now it's everywhere. Okay, so I think it's important because to me, the one piece missing out of our outline here on proper testing for leaky gut is if that person is in a chronic, like post-traumatic stress syndrome, or if they're in a chronic fight-flight response, you get heart palpitations and you get anxiety. So, and we're doing our treatment for the leaky gut, and that's not being addressed. That's kind of going to sabotage the problem at least a percentage of the time, and I would say a significant percentage of the time. So I don't want to confuse the issue there, and that's something that is found out through history and through examination. And we do an adrenal stress index. That's for the cortisol. So I mean, I don't know if it's appropriate to throw that in there or not. I defer all diagnostic testing to Dr. Gates because he's the one who's doing all of the research for us here. And so anyway, but it's just something I see.
Right, yeah, and stress is really important. That stress, like we're saying, won't replace that tissue that's supposedly replacing itself every 5 days. They've done studies in women who take care of a parent with Alzheimer's. So these women were like 50 to 60 versus women who are not taking care of a parent with Alzheimer's. And they showed that if they just do a little puncture wound, that it takes twice as long for a woman taking care of a parent with Alzheimer's for that skin to heal versus someone who's not. Right. And so that's an illustration when the stress hormones are up, we just don't heal as fast. Right. And that can apply to the gut in our clinical experience.
Right. So now on to testing for leaky gut. Yes. Now on to, okay, so we talked about all of the parameters and hopefully understand what a leaky gut is and how the inside of the gut gets damaged. And yet we continually have people come in here and told, you have a perfect colon. your endoscopy is normal, your colonoscopy is normal, everything is normal. Your blood tests are normal. You have every symptom of intestinal and colon problems, and so how do we get from here to there? What testing has shown to be consistently valuable for the leaky gut?
Right. So 5 years ago, we were using the lactulose mannitol test.
Mm-hmm.
Probably some of you have heard of the lactulose mannitol test. In essence, you drink these two carbohydrates, lactulose and mannitol, and then in 6 hours, they collect your urine and they see how much of these carbohydrates are in your urine, in essence.
Where they shouldn't be.
Where they shouldn't be. And so that's the test for leaky gut syndrome. At least that was the mainstay of the testing, really from about 2008, 2009, I would say, till about 2011. And we are just not a big fan of the lactulose mannitol test because we don't feel that it really categorizes things as well as could be done, because this leaky gut syndrome is a complicated issue. Like we talked about, the zonulin, those proteins binding your skin together in your GI tract are really important. The pieces of bacteria going into the bloodstream called endotoxemia are really, really important for a number of disorders. And the lactulose mannitol ratio really only says if things are leaking through too much. They've done other studies on chromium. Chromium is a heavy metal where they've studied this in diabetics. And even though for all you research hounds out there, people will use chromium to treat things like type 2 diabetes. It's an insulin sensitizer, supposedly. We haven't seen great results with it. But
chromium picolinate.
Yeah, but you can give somebody chromium and see how much absorbs into their bloodstream or therefore into their urine. And that's one method of testing for leaky gut syndrome or intestinal hyperpermeability. Now, the test that we have come across, and it really was originated from our group. Our group is a group of doctors across the country where we said, okay, we need a better test for this. And Dr. Vajdani stepped up to the plate. Dr. Vajdani is an immunologist. He's dedicated his life's work to what is termed food immune reactivity. So all you food allergy testing patients out there, you're fixated on food allergies. Really, Dr. Vajdani has pioneered that field. And food allergy is a horrible term because food allergies apply to things like peanut allergies. Most of what you are thinking about or what we deal with are sustained immune responses to eating foods like gluten or, let's say, a tomato or dairy products, where the immune system gets activated for a couple of days. It's a different type of immune response than an allergy. So Dr. Vajdani pioneered that field, and he pioneered this test for leaky gut syndrome. And this test really is fantastic because it looks for breakdown of the intestines from an immune standpoint. So what I mean by that, I'm taking another step back. So if you're
back to histology,
if you're an athlete, they have shown that someone who's an athlete who will do vigorous exercise, like you run as hard as you can for an hour, that you will have signs of leaky gut syndrome.
Right.
And you will absorb too many pieces of bacteria called endotoxemia, and your zonulin will break down. And also, they have done studies where if you just eat a fatty meal, you're going to absorb more pieces of bacteria than if you didn't eat a fatty meal. And so that's where testing for just simply the zonulin in the bloodstream or just testing for pieces of bacteria in the bloodstream is not necessarily accurate of a condition that's going on long-term, like leaky gut syndrome.
Right.
That makes sense?
Yeah, basically, Dr. Gates is about to tell you that this test is going to tell you what parts of your gut are in your bloodstream that don't belong. The structure of your gut are in the bloodstream that don't belong there. And he's saying that there are short-term things like over-exercising that can also kind of muddy the waters by giving a short-term effect that would look the same as a leaky gut when a person doesn't actually have a leaky gut. Would that be?
Exactly.
Yeah.
Exactly. And so now if you're constantly or consistently over a period of time breaking down zonulin, or if you're consistently having pieces of bacteria go into your bloodstream, your immune system is going to start attacking them. We've talked about this at length. This is the whole premise of the autoimmune issue. And so Dr. Vajdani has created the test because he's an immunologist from UCLA, where he can actually track the immune cells to the pieces of bacteria. And he tracks several different types of immune cells to the pieces of bacteria. He tracks several different types of immune cells to the zonulin. And he tracks immune cells to the smooth muscle of your gut. And so this is a fantastic test because it takes away the criticism of testing for leaky gut syndrome. Which, you know, it's just, oh, you just on that day you absorbed too much, maybe because, you know, you exercised too hard, or, you know, you had too many pieces of bacteria in your gut because you had a hamburger, or too many pieces of bacteria in your bloodstream because you had a hamburger that's fatty. And we call them, we refer to this really as a novel test because he thought of this, and Cyrex Laboratories has developed this testing, and that is why we use it on every patient. We also refer to this as a non-phasic elevation of these immune cells. So these immune cells are up because there are these chronically elevated amounts of either proteins from your intestinal tract or pieces of bacteria going into your bloodstream.
Yeah, when you have an autoimmune problem, you're in the alternative field, and I see it a lot. People come in and they're taking a lot of herbs, they're taking a lot of botanicals, they're taking things to stimulate their immune system. But anything that gets through that gut into the bloodstream, or anything that gets in your bloodstream that doesn't belong there, is considered the enemy. And so you're going to have an attack. If you already have an immune system that is in high phasic, is already fired up, looking for things to kill, unfortunately those things at that point in time being your tissues. And now you start to put other pieces of food or other bacteria or other pieces of the inside of your gut, which belong in the inside of your gut and not in your bloodstream, in there. They are seen as foreign objects. They will cause your immune system to, for lack of a better term, fire up, become excited, start to exacerbate. And then that ultimately can start to attack other things. So, and Cyrex Labs were evolved directly from Dr. Vajdani association with Dr. Karazian, who I mentioned earlier, who wrote the book on thyroid, and was the first person I ever heard who talked about this vast autoimmune population that we were going to be seeing as alternative functional practitioners. And so this whole lab is about testing for autoimmune problems and bringing clarity to the diagnosis and giving the clinician the ability to make good clinical decisions and treat. And so I think that leads to how valuable is this test. In the beginning, we were doing more tests. They have a whole array. They call it, in fact, this is called a Cyrex Array too. They have a whole array of tests. They're all phenomenal. But as practitioners who work in a world where a lot of this is still considered novel, it's still considered investigational, experimental, because government agency hats haven't certified putting people on a gluten-free diet or things of this nature, whatever. Insurances a lot of times doesn't cover these things. So Dr. Gates has really helped to get our testing to not just be economical in terms of just doing the testing that we need and gives us the most data, but does so at the most cost-effective manners. And kind of, so when we started doing this, we were doing Cyrex Array 2, Cyrex Array 3, we were doing Cyrex Array 5. These are all autoimmune markers for celiac, cross sensitivities to gluten. And I'm not saying these are expensive tests. For the data they give, I think they're very inexpensive. But when you add them up and you have someone coming in who's got to pay from their own pockets to get well, you know, it can be a barrier for someone. So Dr. Gates, I noticed, started to, he always gives me the reports with all the testing on and everything. I started noticing the testing was getting less and less and less and less. And so we meet every Saturday morning and talk about things. And he educated me on why this test is, how we infer so much from this one test.
And yeah, and we're in the process of writing an article for really functional medicine and functional neurology practitioners from around the country, why every one of them should be performing a Cyrex Array 2 on their patients.
Wow.
Because it is, you can get so much data from it. And we're not saying not to do a Cyrex Array 3 or 5. We still do them on occasion.
Occasionally.
Yeah, and they're incredibly helpful. But for the majority of our patients where we're at, this is the biggest bang for your buck, and really it's a necessary test if you're
of cost for no option. My God, we'd be doing
we do all of
tests.
Yeah, exactly.
They have a lot of
all
tests.
The data.
I mean,
made my life a lot easier.
I mean, but it's
no.
You know, that can be financially challenging for a lot of our patients.
Right.
So this is the one.
It is the one because it tells you exactly what's going on with the gut. It tells you, and another thing is how broken down is your gut. You know, everybody now with the internet is a doctor. And doctors love this because everybody can go on and read about the GAPS diet and, ooh, I want to do the bone broth, and ooh, I want to take glutamine, and ooh, I'm going to take my slippery elm. All that's great, but how you got to know how to put it all together, and you have to know how severe is the issue. And the Cyrex Array 2, in our opinion, tells you how severe the issue is, because it not only tracks the immune cells to all those different tissues that I described, from the smooth muscle to the zonulin to the pieces of bacteria breaking off, but also it tells you how many immune cells are being created. And so we've come up with a criteria based on what we see within the Cyrex Array 2 layout of how long it's going to take to heal the leaky gut syndrome. And for some patients, it takes 2 weeks. For some patients, it takes 5 to 6 months.
Yeah, and if you have a test in front of you that's telling you, well, this person's not that severe, and you're working on that person, and all of a sudden they're not getting better, you kind of know you're missing something.
Right.
And and on the other hand, you know, if they tell you it's very severe and the person's not getting better, well, you kind of relax for a while and say, well, it's really severe. It's going to take time for this person to get better. So it allows you to manage that patient clinically with a lot more certainty, and doctor certainty tends to calm patients down when they're going through difficult times as they're getting better. And so it really is, I mean, I'm the clinical guy. He's the scientific guy. He's both scientific and clinical. But I mean, I did nutrition in the early 80s. And then the reason I stopped doing it and went to a strict musculoskeletal practice as a chiropractor until I got sick and got everything we talk about, was because I wasn't really comfortable with the tools. There were no tools. I did some kinesiology. Frankly, I'm not saying kinesiology is not good. I'm saying I wasn't good at it. And I had a hard time doing a muscle test and then localizing a thyroid and then giving some thymus or tyrosine or iodine, and the patient would get worse, and I would know why. And so, I mean, I had to stop. I just was like, I can't. The best results I would get would be when I would give people a diet. And one time, one of my colleagues gave one of my patients a gluten-free diet, and she lost 60. But they called it. He just took her off a week. This was like 1982. It was like miraculous results, and I couldn't wrap my head around it. But back then, we had to be clinical diagnosticians. We didn't have the testing. We didn't have, like I said, even as MRIs at the time. We didn't have MRIs. And when they first came out, they were a disaster. And I could do hours on that. So now, now having this data is so valuable if you know how to use it. And Dr. Gates is doing all the clinical work here over the last 3 or 4 years, whatever. He's been able to see which of the tests are really needed. One of the things that we had hoped to do here was to say, look, if you think you have leaky gut, if you've been on the internet and you think you have it and you brought it up to your doctor or whatever, and funds are, even if funds aren't, you know, an issue, this is the test. This is the test to do that'll give that person the most data as to how you should manage getting better. I have a lot of people coming here. They went online. They got on leaky gut on the leaky gut protocol, and they felt better. And then they didn't feel better. Maybe they had severe leaky gut. Maybe they needed to go longer. Maybe they needed to know which layers of that intestine it was damaged, and that might have directed further what types of maybe botanicals or
Mhm.
that they might have used. So, but it's proven to be a grand slam home run for us. So we're very grateful to Dr. Vajdani for developing this. Did you want to summarize leaky gut effects, or do you feel like
I think
we've
we've
kind of sort of
covered
gone
it.
through
Yeah,
that,
we've gone through all
through
that, so I
everything
don't think we
else?
really need to.
Because it feels like we've already kind of handled that, and it's quite an important entity. It's like the centerpiece of our practice. I will tell patients when they come in who maybe aren't aware that they kind of blow. We have a check sheet for when people come in, and we have them check off. Maybe there's like 30 little boxes, and it has digestive bowel problems and thyroid problems and chronic fatigue and arthritis and all that. And we have them check off what they have or have ever had. It's amazing how many people just don't check the gut. And in my world, that's almost impossible if they're coming in with all these other problems. So I'll say, are you sure you don't have a gut problem? Like, are you sure you don't have bloating? Or are you sure you don't have, and they might say, well, I didn't think that was a big deal. Or they might say, since I changed my diet, my gut is feeling better. But in our world, I will tell them, if you have a gut problem and you have almost any kind of chronic pain issue that there is, and I'm beginning to expand that to chronic neurological issues, it all starts in the gut with us. And the vast majority of our patients have a leaky gut. It is a rarity that we see
Right.
somebody who doesn't have it. And we see people who don't have it,
Right.
but it's so this is to us. Hopefully, there were people who watched this to hear what we had to say, because we have no axes to grind here. We're just telling you what we use every day to achieve consistently successful results with a lot of the conditions that we treat. And if the gut doesn't get better, that case is going nowhere. So, and this is our main test as far as getting from here to there. So,
I'd agree.
okay. So that's it. Any questions that you have, send it to powerhealthtalk.com. Dr. Gates, unlike what I said last week, actually does answer all of these. And Dr. Gates will do his best to answer any questions that you have, any suggestions that you have. We get more emails and we get more suggestions each week. We look at them. We've come up with a new grouping of I think are going to be very interesting topics, at least over the next 7 or 8 times. These are topics that patients are interested in when they come in here every day. We're going to try to clear up the challenge of parasites. A lot of people have attention on parasites. We're going to talk about gout and candida and how they're kind of downstream, what we call downstream conditions that really are being caused by a lot of other things that are going on. We're going to talk about female problems at some point. That was a big one yesterday in my world.
Okay.
And we're going to talk about viruses. We're going to talk about a lot of the bits and pieces of things that there may be some maybe data out there that isn't as accurate as it could be based on what the newest research is, but more importantly, based on what we're finding relative to the actual clinical application, helping people to get better. So until next week, thank you for watching, and I hope you enjoyed this talk.
Thank you for watching.